Swadika and good afternoon. Today is Friday, the 28th of January, 2022, and this is the English language summary of the press briefing by the Center for COVID-19 Situation Administration, or CCSA. Let me begin today right away with a quick summary of the Thai briefing given just now by Dr. Apisamai. A couple of points or issues in particular that I believe may be of interest to our English language audiences tuning in from home. And that is first that the meeting discussed this morning the appearance of clusters still in a variety of settings, namely eateries, religious activities such as weddings and other religious activities, where afterwards there would be large gatherings and eating together and groupings together where those clusters were found later on. Another topic that was discussed was the issue of the appearance of some clusters in schools or school settings and the situation there. A variety of different types of schools, private schools, public schools, and in particular, one cluster in Ratchaburi province. The observations that the meeting made was that the clusters likely appeared as a result of group activities that were conducted at the school. So emphasis was made on monitoring children's health very closely and ensuring that the Ministry of Public Health and the Ministry of Education continue to work closely with all schools to ensure that they follow the proper guidelines for cleaning, isolating, or recommending isolation, testing, and of course, avoiding large group activities and celebration. An emphasis was also made this morning that we do really have to make an extra effort to learn how to implement the smart living with COVID policy. And this is really ensuring that the measures we have in place and the practices we have in place do become second nature for us if we are to continue to live with and manage COVID efficiently and effectively. Let me now turn to, and this was also discussed just now in the Thai briefing, the resumed Test&Go scheme. We are approaching the 1st of February very soon. It's coming up next Tuesday, which is the day that registration opens once again for the resumed Test&Go scheme. I hope that some of the clarifications that I provided at the last briefing this past Tuesday were helpful. There were a number of lingering questions that followed that briefing, which I would like to clarify here today. And of course, if there are any more questions, I will certainly aim to clarify those on Monday coming up. So that question for today is how the Test&Go scheme works for fully vaccinated international travelers who would like to travel to Thailand for less than 5 days. How does that work? The answer is that those travelers planning to stay in Thailand for less than 5 days entering through the Test&Go scheme can certainly do so. And instead of the second RT-PCR test and hotel booking, you would only have to show or upload in the Thailand Pass a copy of your outbound air ticket, reflecting, of course, a date that falls within those 5 days of stay in Thailand. I hope that this brings some relief for those of you planning short trips to the kingdom, as the Test&Go scheme would basically work as it did before, with only one RT-PCR test and hotel booking needed for those who are staying less than 5 days. Again, for those staying beyond the 5 days under the Test&Go scheme, please do book those 2 tests and hotel stays, which again can be made in different hotels in different provinces if it suits your schedule better. And again, for those who have already received a QR code prior to the 1st of February, you can travel with that code or reapply for a new one under the resumed Test&Go scheme. But if you do decide to travel on the old code, you will be able to go to a government designated facility for the second test on day 5 or 6 free of charge. We have a slide coming up for you very shortly with all of the information related to the resumed Test&Go scheme. I hope that slide will come up very shortly indeed. And if it does not, you will find this infographic on the website of the Department of Consular Affairs. And there we have it. Thank you very much, team. We'll find that on the website of the Department of Consular Affairs, as it is certainly quite impossible to read through all of that very quickly on screen. We have also that QR code there for you that you can take a picture of, and it will lead you to this infographic as well as a Q&A section, that we hope will be useful for some of the questions that many of you have sent to us over the past week and a half. So there's the QR code for you to take note of and to use as you see fit. Let me now return to our usual updates that we have for you at this briefing, which is an update on the arrival of travelers, international travelers to the country. During the 1st to the 27th of January, 2022, a total of 170,479 international travelers entered the country. Of this number, the majority, or 69,488 travelers, continue to enter via the Test&Go or a quarantine exemption scheme. Another 70,593 entered via the Sandbox scheme, and as you see there, 30,398 through the alternative quarantine scheme, meaning unvaccinated or not fully vaccinated persons. Another slide that will come up very soon, the majority of international travelers coming from these top 10 countries of origin, as you see there, during the 1st to the 24th of January, namely Russia, Germany, the US, the UK, France, Sweden, Australia, Japan, UAE, and Denmark. Let's turn now to the general situation of COVID in the country domestically. Today, we have new confirmed cases logging in at 8,450. That's a slight jump from previous days, but still in a relatively manageable range of 7,000 to 8,000. We have new recoveries at 7,484 and fatalities, unfortunately, a little higher than we have been seeing today at 28 cases. As was mentioned in the Thai briefing just now, Omicron is now the dominant variant in Thailand. It was also reported in the news today, and it is accounting for 94.6% of patients, while the Delta variant accounts for only 5.4%. In that same report, which quoted a Thai health official, and in the Thai briefing just now actually as well, it was underlined that the new stealth, as they are calling it, as well as the original Omicron, so you have two variants of the Omicron variant, are very similar and not leading to severe symptoms. And it was underlined as well that both can still be detected very well by the ATK test. Still, we are discovering more and more each day about this variant. So for the government, erring on the side of caution is perhaps the best policy when it comes to our friends, our family, and our loved ones. So we continue to encourage everyone to continue to follow universal prevention measures for COVID-19. Let's have a look at another slide coming up very shortly, which we usually do, and that is the top 10 provinces with COVID-19 cases. There we go. We have the numbers there for you, and the top of the list, once again, Bangkok at 1,292. Green being a number that is less than the previous day. So that's a bit of good news, or is it the silver lining for Bangkokians today. We have 10 top provinces there: Bangkok, Samut Prakan, Nonthaburi, Chonburi, Phuket, and the list goes on. Turning now to vaccination progress, or progress in our vaccination drive. Yesterday, we administered a total of 465,154 doses of the vaccine, which increases the accumulated number of vaccinations to more than 114 million doses. This fortunately brings us to 75.1%, which is over 52 million people of the population receiving their first dose, and 69.6%, that's almost 70%, having received their second dose. The remaining 19.3%, which is over 13.4 million people, have received their third dose. A reminder for our foreign friends and residents in Bangkok and the vicinity who would like to have a third dose of the vaccination or that booster dose, you can register via the mobile service providers shown on screen there. We are reminding that while it is important for the general public to get a booster shot 3 months after receiving the second dose, a fourth shot is not yet necessary for most people. That is all I have for today. In the coming Chinese New Year celebration this weekend and early next week, we thank everyone for your part in fighting COVID and continue to request everyone to take extra care this holiday season. Be sure to mask up, stay in well-ventilated areas and eateries, wash hands frequently, and the like. Thank you very much, and สวัสดีค่ะ
ครับขอบพระคุณ